Do you know what no one tells you about caregiving? There is no manual, no map, just you trying to figure it out, and often in the dark. But what if there was a way forward? Hero Generation is building exactly that, a space with the tools, the guidance, and the connection that we all wish we had from day one. Because no one has to do this alone. Visit herogen.co. It is free to start, no credit card, no pressure, just the real support when and where it matters the most. And with all of the support that I find so valuable at We'll Gather, everything we do comes back to one thing, and that is connection. This is why I love partnering with HeroGen and Zinnia TV. Zinnia TV isn't just about the video content. It is a lifeline for those living with dementia, for their caregivers, for professionals. It's carefully designed to bring that calm and joy and sense of being seen and supported. Zinnia TV is here to support you and your loved ones when you need it most. Visit zinniatv.com and use the code GATHER20 for 20% off. Let's keep making every moment count together. This is a really fun episode to share. You will notice that the audio will sound different. Adria Thompson, a licensed speech language pathologist and a dear friend, and myself and Carrie Aalberts, we were in Cannes, France last year at the Silver Echo International Festival. Adria and I had the opportunity to record this episode as we talk all about refusals of care in dementia. So what do we do when someone we love says no to the very thing we believe will help them the most? When the care that we're offering, maybe with every good intention, gets met with resistance, pushback, or a flat-out refusal. And if you've ever stood in those tender but frustrating moments, you are absolutely not alone. Refusals of care are one of the most common and challenging experiences for anyone supporting a person living with dementia. But what if the issue isn't just what we're asking, but how, when, and why we're asking it? Adria shares with us all about how we navigate these moments. You will learn so much practical ideas, insight. Adria is an award-winning educator, a brilliant mind behind Be Like Care Consulting, a care influencer, and she brings a compassionate voice to family caregivers, professionals, people living with dementia. And I know that you will get so much from this episode. So here is my interview with the wonderful Adria Thompson. We are at Silver Echo in France.
Yes, this is so exciting.
I know. I'm so happy to be here. We had a great day yesterday. We were on a panel. You won an award.
I did.
Tell us about what award did you win?
I won the International People's Choice Award, so super exciting, and then honorable mention in the caregiver support category. So I totally was a surprise, but it was so exciting.
So fun. It was super really fun to see you do that. Today, we are talking about an important topic, but before we do that, we'll introduce ourselves. So I am Nicole Will, founder of We'll Gather and co-founder of Think Tank. I am also the host of Navigating the World with Your Aging Loved One podcast, and I elevate and empower caregivers, voices in the care economy, so that we can have a world where people feel supported in the information that they have in care.
And you're so good at it.
Thank you. Thank you. That means a lot.
And my name is Adria Thompson. I'm a speech language pathologist in the United States. And I own Be Like Care Consulting, where I create short-form videos that are 90 seconds or less on social media and really practical information for personal and professional caregivers to know more about dementia and know how to care for people with dementia. And dementia is what we're going to talk about today.
It is.
It's all I talk about, so.
And we learned so much from you. You have such an impact in this world of dementia care, supporting those living with dementia and their family members. And an important topic is also refusals of care in individuals with dementia. Tell us more about that. How do you define that and why is it important?
Yeah. Refusals of care are, definition is that you are rejecting evaluation or care that is necessary to achieve a person's goals or health and well-being. A lot of times we call this being non-compliant, being uncooperative, being resistant or agitated, right? We see that sometimes in individuals with dementia where we need to get them to do something that they don't want to do. And it's one of the biggest problems in dementia care because it is the reason why we often will have to bring professional caregivers into a home, or a person has to go to a long-term care community. Because if you can't get the care you need at home, then that's a problem. But these problems also exist in long-term care communities where people will be needing to take their medicine or to take a shower and they refuse. So refusal of care is just where you decline. I think decline is probably a better, more accurate word, but you decline care. And it's important to note that this has to be, for it to be a problem, for it to be a refusal, it has to be against a person's goals for care. So for example, someone who might have religious beliefs about not accepting blood transfusions or something right? If that is something that they have determined a long time ago and that is part of who they are and their goals, then saying no to a blood transfusion should never be considered a refusal of care. That's just a decision that they made. But the term refusal comes a lot of times in documentation in medical facilities. So whether it's a hospital or a nursing home, if a person does not accept care, it can be documented that they refused. And a lot of problems can come with that. It can make them look like they're a person that's difficult to care for, which can limit their resources, their access to the things that they need, like going to a specific nursing home, for example. So there's some implications for abuse or neglect when it comes to refusals, which we can talk about a little bit more. But yeah, refusal of care is a huge topic, especially in long-term care, but also when someone with dementia is living at home.
Right. And I hear, a lot of families will share that as a common frustration, right? They have a desire to have their loved one complete certain things in life, and when they're not able to do that, it can be frustrating and overwhelming. It's important for us to understand about dementia and what causes a person to refuse care.
Yeah. So dementia is, I guess we'll define that real quickly to explain why it can cause people to refuse care. Dementia is a condition. There's kind of two criteria. The first is that dementia causes a change in thinking. So that means that a person has functioned typically with their brain. It's not caused them any problems in their life. And then all of a sudden there's been a change from that. And all of a sudden it is, it's outwardly obvious that there's been a change in their brain. And the second criteria is that it has to affect their daily life. So that change in thinking is affecting their ability to care for themselves and to move throughout their lives normally. And so there are many types of dementia. We are familiar a lot with Alzheimer's disease. It's the most common. That's what you hear about the most. There's also frontotemporal dementia. There's vascular dementia, Lewy body dementia. But all of these fall under that category of having a change in thinking that's affecting their life. And so the things that people with dementia experience, or the symptoms that they experience that can cause them to refuse care, one of the most common is short-term memory loss, right? So, Nicole, if you didn't remember eating and someone tells you that you already have, you're going to fight that, right? And so you might get agitated, some of those words, right? But when it comes to refusal of care, what if you have a false memory? What if you remember that you showered this morning? Like, you know that you did. You have a specific memory of it. And then I approach you and say, let's go, Nicole, let's get in the shower. And you say, I already have. And I say, no, you haven't. I've been with you all day. Right? So it's the faultiness of memory, not just short-term memory loss, but false memories can really cause people to have that decline care or refuse it because it doesn't align with their reality and what they know. We also have disorientation, right? So if I ask you right now, we're sitting in a common area with people are looking at us, and it's a big room in a fancy place, and I start trying to take your clothes off, you're going to refuse that, right?
Right.
Because you're like, this is not the time nor the place. Well, some people with dementia are really disoriented, even in private moments, even in the bathroom. They misinterpret a safe space as something that is unsafe. And so they refuse care in those moments, right? So when we start to think about what their reality is and what their brain is telling them, of course they're going to decline to participate in some of the things we want them to do. But often we don't have that awareness. We could get into, hallucinations, how that can cause fear. There's something really interesting called Capgras syndrome, which is a belief that's like, I could look at you, Nicole, and think, I know you look like Nicole, but you aren't her. You're an imposter. And so all of a sudden, even though you're my friend and I've known you for a long time, I don't trust you because my brain is telling me that someone else has taken over you. It sounds absurd and like so far from reality. And it is, but sometimes with a brain disease, that's what happens. So those kind of symptoms can definitely cause someone with dementia to refuse care.
Yeah, and it helps us so much when we understand the disease and what our brains are doing. I think a lot of times there's families and people that work in care, if we don't fully understand the science almost behind that, we might take that personally, or feel that it's something that we're doing, and that can be incredibly challenging, incredibly frustrating. What are the most common tasks that are refused?
Yeah. I've looked into this quite a bit, and you can look at research, but also experience of working with people with dementia for 10 years tells me it's a lot of hygiene tasks. So things like showering, getting dressed, going to the bathroom, brushing teeth, those kind of things are often the ones that are most often refused. And for a few reasons, like I said before, sometimes people think that they've already done those things because they have memories of doing them their whole lives. But also, it's a very intimate task. A lot of those require taking off clothes. These are things that we typically don't do when another person is present, unless they're like a romantic partner or something. So a big challenge comes when there's a task that someone with dementia needs another person there to be present for. So you're used to showering your whole life, and then all of a sudden a random stranger to you, even though they might be your home health aide, or even your granddaughter or your sister or your brother, is there to say, no, you fell last time, or you get confused, you don't know what you're doing, so I need to be standing here while you're naked and getting into the shower. So all of those tasks that require intimacy, vulnerability, and also those more complex tasks, we take for granted how complex things like showering is. It's like a 12-step process, and you have to do things in a certain order, and you have to use products in a certain way. Those things are really challenging. So it's those really intimate things that are the ones that are most commonly refused. And in the medical setting, we also see things like IVs or things that require pain, So I know my grandmother lives with dementia, getting her blood sugar checked, getting insulin shots, all of those things that make you just a lot of discomfort, those things can be refused as well.
I remember, I think you had shared about it. I don't know if it was a story or a video, but you were explaining how many steps to take a shower. And I was surprised because we think, I just take my clothes off and get in the shower. And, you know. And when you break it down, you understand the complexities of having to walk through each step with that. So there are things that can happen if these refusals or when people deny care aren't addressed. What are some of those implications to that?
Yeah, the consequences of refusal of care are pretty big. Okay, I mentioned one earlier, and I know this from personal experience. My grandfather was in the hospital. He didn't even have dementia, but he was going through a medical condition that caused him delirium, which is like short-term medically induced confusion. And he needed to go to a nursing home for short-term rehab. And the nursing home that we wanted as a family, that we loved in our community, declined him. They said that he couldn't come there because they looked at his chart and he was documented as being combative and refusing care when someone tried to bathe him at 3 a.m.
Wow.
Right? Like, I would fight that too.
I wouldn't want to do that.
Right. And so documenting refusals of care can be detrimental because it is like a permanent record. You know, like back in school, I always thought there was like this, you hear about a permanent record that it follows you throughout your whole life and it affects everything. It's kind of like that medically. Yeah. It's a stain on your report, and it can cause people to not want to work with you. Or to allow you into your community. But beyond that, refusals of care can cause neglect. So if someone, let's say, is incontinent and they're constantly, every time you're trying to take them to the bathroom or help them get cleaned up, they say no, and then there's a possibility that they could be neglected because they're not doing the hygiene things they need to do. We also see a lot, it's affecting the person who is receiving care, the person with dementia, but there's also a lot of negative consequences to the caregivers. So the person who's caring for them, whether it's a family member or someone professionally like an aide, it causes a lot of stress, a lot of burnout. It's really taxing emotionally, and especially when we have like life-sustaining things that they're refusing, that is a ton of stress on a caregiver. So if you're trying to get your mom to eat and she's refusing to eat, right, we use that word refusing, over and over and over again for multiple days, it feels like life or death. And that is a lot to carry. So there's a lot of consequences for the person with dementia, but also the caregiver.
So how do we overcome that? What can we do to decrease those refusals of care?
Yeah. I'll give some like overarching principles, and then maybe we can give some examples. Yeah. So we need to utilize what we know in the medical field as person-centered care, right? So personalized, customized care. So we need to know the person well, because I can give you tips that have worked for some people sometimes, but that doesn't necessarily mean that it's going to work for your person this time. And so we need to know the person well. We need to consider how they see themselves, how they, their personality traits, how they just move throughout the world, and the things that motivate them, things that they like, right? Whether it's a sweet treat or recognition or respect. All of those things can be used strategically in trying to get someone to not refuse care. And I'd like to kind of set a lower standard to say we can't prevent refusals of care, because any of us, even without dementia, can refuse to do something. That's going to happen. But what we can do is make accepting care the most attractive option. Give them the best possible chance of accepting care. That's our goal. We're not going to do 100% all the time. We're just going to try to set up the world in a way that makes them more accepting of care. So what we're going to do is we're going to make them feel safe. That's really important, especially in those vulnerable tasks. And we're going to listen to their actual objections and accept them as the truth. So maybe an example will help?
Yeah? Let's do it.
Okay.
I want to hear it.
Maybe we can say, okay, for example, just a simple one. We want someone to drink more water, okay? We might have a tendency to come at a person and say, Mom, you need to drink more water because you've had UTIs in the past, because the doctor said you need to, this has been an issue, it's going to make you feel better. And we list off all the reasons, the great reasons that someone needs to drink more water, that we all need to drink more water. And then the person with dementia says, I don't want to. Okay, what do you do with that? What do you do with that? Because when we point to remember those UTIs you had, we're asking them to do to utilize short-term memory that is diseased and dying and damaged right now. So that's probably not a good thing. When we talk about what the doctor said, that is reasoning, right? Like, we have to do this because reasoning is often most affected in dementia. So what we need to do is think, okay, in this moment, what could I do naturally that would make a person more willing to drink water that feels comfortable and normal? So let's say you and I are sitting here with 2 glasses of water. Instead of saying, Nicole, drink water, drink water, drink water, I might raise up my glass and look at you and say, cheers to a good day. What are you naturally going to do?
Cheers.
Yeah, you're
Take
going
a
to reach
sip.
out, you're going to take your glass, you're going to clink it with mine, and you're going to take a sip of water, right? So thinking about ways that we naturally do things that we can motivate someone. Now, if you are a person who has never been to a fancy dinner, right? You grew up on a farm and you don't drink wine or whatever, you might not respond to cheers, right? In the same way. So you got to know that person and think, what is a natural way that I can make them want to do something? So in that case, I might say, Nicole, here, can you try this? It tastes kind of weird. What do you think? Like, do you think it's okay? Or I give you 2 glasses of the same drink and say, take a drink of this, take a drink of this. Which one do you like better?
I love that.
Right? And you say, this one's fine. I say, okay, you can keep that. I'll take the bad one, you know? So just natural ways without being so confrontational. I don't like being confrontational with dementia because they can't always understand all the becauses behind things.
Absolutely. Absolutely. With your role as a speech language pathologist, communication is so important. And I remember you sharing about not only is it about speech, but it is a huge piece of it is the receiving of the communication and the techniques and the strategies behind that. So what role does communication play in decreasing those care refusals?
Yeah, I'm biased, but yes, I think communication is so important as a speech therapist. And so yes, communication, we could break it down into 2 main categories. There's expression and then reception, right? So expressive communication is speech, what we're doing right now, what we think about when we think about communication, but it's also writing. That's another form of expression. And then on the other side, we have, receptive communication, and that could be understanding what you hear, which is also what we're doing right now, right? You're looking at me nodding, indicating that you are understanding the words I'm saying and the concepts behind it. But then also reading is another form of receptive language. So communication is really important. We can focus too much sometimes on what a person is saying and forget the fact that they might not be understanding.
Yeah.
So when we are working with someone with dementia, someone who's living with a brain disease, we have to understand that they're not ever going to be the person that changes. They're not going to be the person that adapts. We have to be. So we can change the way that we can communicate with someone. In that example, instead of saying it's not necessarily making words simple, like we don't have to talk to someone with dementia like they're a child, but it's just simplifying the concepts. So instead of that water explanation, here's because and urinary tract infections and your neurologist said, it's saying, hey, cheers. Let's cheers to the day. And we do that 12 times in an hour, right? It's simplifying these concepts and using language that is familiar and that is safe. I want to also say, to that point of not speaking to people with dementia like a child, that's called elder speak. And I want to give you an example because sometimes we do it with the best intentions. And it sounds like this. Oh, hi, Charles. It's so good to see you today. You look so good in your suspenders. Are you having a good day? Right? Okay, we've all heard that and we've probably done it. At times, we think that we're being so sweet. And, if that's how we talk to everybody, that's one thing. But if we're turning that on when we talk to someone who's older, it's demeaning. And it is, research has shown that it's ineffective.
Wow.
That speech is ineffective. So just on a normal, on a objective level, it's not preferred. So we're going to talk to them like we do anyone else. We might add more pauses in between our ideas and not speak as fast as we have been on this podcast, right? That's simply to give people more time to process and to think about how they're going to respond. And we also my favorite tip is to decrease use of pronouns. So when we say he, she, it, that, those, these, we are referring back to something we said earlier. So in the idea of decreasing refusal of care, we might say, hey, Mom, I want you to take off your clothes and before we get in the shower, because I'm going to do a load of laundry. So if you could just put those in the hamper. Actually, could you put them on the hangers in the closet? Because I don't think that they are dirty. Right? As we go throughout that conversation, I'm saying them and those and it. And I'm not referring back to the clothes. I didn't say the word clothes again. And so what happens with someone with poor attention, which people with dementia can have, and short-term memory loss, what we're doing is we're making our speech really complex, and we're asking them to hold on to things for a really long time. So instead we could say, hey, Mom, can you put your clothes in the hamper? I'm going to do a load of laundry. Actually, your clothes aren't that dirty. You can put your clothes on the hanger and put them in the closet. It's not that you don't use pronouns ever, but you just use them less.
Wow.
Isn't that cool?
That's so cool.
And it makes a
remember
difference.
that. It
Yeah.
really does. It really does. Environment plays a big role in all of our lives, right? I mean, for me, I'm sensitive to lighting or maybe temperature. What role does environment play on addressing that refusal of care?
That's good. So, yes, the environment informs how we move throughout the world. I gave you an example earlier. If I were to ask you to take your clothes off in this environment, in a very public space, you wouldn't do it.
Nope.
But we're actually staying in the same apartment, so if you were in the bathroom and I told you you had to take your clothes off with the door locked and I wasn't in there with you and you're just in your bathroom, you'd be more willing to. Mm-hmm. Sure, you'd be confused as to why I'm asking you, right? But the willingness is different in different environments. So we need to make an environment feel safe. Even though we think an environment is safe, closed door in a bathroom, if for whatever reason someone with dementia is interpreting it as unsafe, we have to do whatever we can to make that feel better. So for example, some people with dementia lose their ability to recognize themselves in the mirror, right? So they look at themselves in the mirror and they think it's a different person. So that, even though we know no one else is in the room with you, we might need to sometimes we'll use like a curtain, or some caregivers have used like wrapping paper to just cover up a mirror in the bathroom so that they don't see themselves. That might make them more accepting of care because all of a sudden there's not that other person in the room. Environment can also, we talked about receptive language also being reading. We can put signs up. I had a woman who kept forgetting. Every time I would help her to the bathroom, she would be agreeable. But if she turned her back to the toilet and took too long to take off her clothes, maybe she was really chatty. She's talking to me. She's, saying nice things about my shirt and asking me questions about my family. And then I say, okay, let's take your pants off. Then if her back is to the toilet, she's already forgotten that she's in the bathroom, and so that request doesn't make sense to her anymore. So I put a sign behind me on the wall so she was looking at that says, I am going to the bathroom. Just to remind her over and over again of what she's doing.
Right.
So we can use, we can put in a space heater in a bathroom to make it more warm and cozy for showers. There's a lot that we can adapt. Also, people with dementia who get distracted easily. If we're going into the bathroom to use the toilet, for example, and I know that all the little decorations and the soap and the toothpaste and the toothbrush and the lipstick on the counter might distract her from the task of going to the bathroom, of sitting on the toilet, I might go in before and take everything off the counter, put it in the cabinet underneath. I've even taken paintings off the wall.
Wow.
Like people who I know get really distracted. We need to make the task, the thing that they need to do, the most interesting
Prominent.
part of the room. Yeah. And so kind of cleaning up and changing the environment can really be helpful in decreasing refusals.
I love these practical examples. One we hear often is you had mentioned it briefly earlier, but taking a shower or bathing. Give us an example so we feel like,
Yeah.
we can overcome that a little bit when someone does refuse to take a shower.
Okay. Yeah. I'm going to give you two of my favorite. These are like kind of extreme examples, but I think that might inspire listeners to be more creative and realize that there's a lot of options out there. So, I had a woman, I worked in a long-term care community. We'll call her Ruth. And she did not shower, like left to her own devices. She would never shower. She hated it, felt very uncomfortable, always thought she had already done it that morning. And one thing I know about Ruth is that she loves activities. From the moment that she wakes up to the moment she goes to bed at night, she is out in the common areas talking to people. She is doing every arts and crafts, every puzzle, every bingo, everything. She is always hands-on. And that was one of the reasons why it's so hard to get her to do anything during the day, is because she didn't want to be pulled from those things from her friends. And so we were trying to think, what could we do to get her to agree, to be motivated to take a shower? And we landed on trying at the end of bingo one day. I stood up and said, okay, there's one person we are going to draw a name to win an all-inclusive spa day.
Amazing.
Yes. We are going, this is, top dollar spa day experience. All right, so have everybody's name in this hat, and I'm going to draw out a name. And Ruth's name is the only one in the hat, right? I pull out a piece of paper and I say, Ruth, congratulations. And everyone claps. And we had set this all up before. The bathroom, we had her go in. It was like a big spa bathroom in our community. And we had a diffuser in there. We had a space heater. We had music playing. All the staff knew that this was the thing we were going to do. And she was in a wheelchair. And she got so excited. And we said, okay, we have to redeem this right now. And so we were wheeling her down the hall. And everyone is like cheering and like high-fiving her, like congratulations. She felt like a princess. If you would have taken her into the bathroom, which we had many times tried, and said, Ruth, it's been 3 weeks. You stink. You say all the things, right? Inappropriate things, but sometimes you try lots of different techniques. And she would never, of course, that's really confrontational. That's not her reality. But then all of a sudden we tell her that she wants a spa day, and she was in there for like an hour, head to toe, toenails trimmed. The whole works.
Wow.
We end up doing this about once a week. We talk to her family, head to toe, cleaning, and she won every time. And she was so excited. She was so excited. And the other example I want to give is about a man who also, same situation, he did not like to shower. But I thought about, he always said he just did. So I thought, okay, if I had already showered and someone asked me to again, I wouldn't want to either, unless there was a specific reason, right? Like it takes a long time to dry your hair, you got to do your makeup again, you got to get dressed, and So I thought about my husband. He always showers twice a day in one situation. It's when he gets his hair cut. So he'll shower early in the day, right, normal. And then whatever time he gets his hair cut that day, when he comes home, he always feels like he has to shower again because he hates the feeling of hair on his neck or on his skin. Yeah. No matter, using a cape or whatever, it's still there. And so I had this idea with this man. We'll call him Bob. And so I said, Bob, come in here. It was during COVID where we were all doing every job, right? Mm-hmm. So as a speech therapist, I was like cutting people's hair, right? So I go in and we set him in his bathroom and I say, I'm going to cut your hair. We're going to trim your beard. And I did all of that. And I purposefully did not put a cape or a towel over him at all. And so there were millions of little tiny hairs all over his clothes, all over his skin. And so at the end, I looked at him and I said, oh my gosh, Bob, I'm so sorry. I forgot to put a cape over you. Oh my gosh. I apologize. Here, let me turn on the water real quick and you can step in and rinse off. You know what he did? No problems. Stood up. He was like, honey, it's okay. Because we built rapport. That's also really important, to just make them like you, right? Like, be kind. And so turned on the water for him. He stepped right in, showered, no problem, right? So it's techniques like this. You have to think through, in what situation would it make sense for them to do this thing we need them to do anyway? but in a less confrontational way.
Yeah. Okay. Share with people. It's one of my favorite sentences that you use. Do you know what I'm saying?
I don't know which one it is.
Everything.
Oh, um, everything makes sense to someone with dementia.
Yes.
So everything someone with dementia does makes sense to them, right? Everything they do. It is so important to believe that, because if we look at someone with dementia who's doing something unusual, refusing care, right? And we have the assumption that there's a reason and it makes sense to them, then we keep digging deeper, right?
Yeah.
And I don't ever want to like portray me or these techniques as like I get it right every single time, because that is not the truth. As a speech therapist, we work with data. We take, take data on like things that work and things that don't work. If you were to follow me around and like take data on my attempts at things, I would probably get things like have success in a dementia challenge maybe 10% of the time, right?
Yeah.
You have to try things and fail over and over and over again before you find the thing that works.
Right.
But once you find the thing that works, that can be life-changing, literally, for them and the carer, right?
Oh,
so believing that everything that someone with dementia does makes sense to them is really important.
And along with that, what might work one day might not work the next day. So
Exactly.
to keep being curious, keep changing, keep evolving if needed.
Yes.
If
I
needed.
mean, dementia is a moving target because
Yeah.
they're progressing all the time, right? And it's not like day to day, it's not always obvious as it is when you look back, 6 months ago. But yes, things are different daily at times. And so we always have to be creative and adaptive.
Absolutely. We have one last question. And for people that are working in long-term care communities, how can we use these techniques, or what do we need to consider when we're in those environments?
Yeah, I think the hardest thing, because I've spent my career in long-term care, working in nursing homes, memory care, assisted living, and the biggest thing is that I don't know my residents well. And sometimes when they come into the community already with dementia, potentially progressed dementia, then it can be a challenge to know what motivates them, to know their background, to know their history. So I think that's the biggest barrier. And sometimes people, like our residents, don't have families to advocate for them. And so, and to tell their story. So that can be, I think, the biggest challenge. But I encourage anyone working in long-term care to pursue that, to keep, sometimes I've learned a lot from Googling my patients.
Yeah.
I know that sounds silly.
I get a little background.
Yeah, I get a little background because, in this day and age, like, they might have a LinkedIn. Like, they might have a Facebook. So there are times where I have to kind of, like, do a little deep dive to see if I can find out things that, not just so I'm, like, curious, but so that I can find things to know, like, this person was a lawyer. I need to, like, allow them opportunities to be respected. And they're always going to know that they are right? There's little things like that. But in long-term care, I think a lot of times when I teach these kind of techniques, like on my social media, one of the big things that people say is, like, we don't have time for that. But my challenge is, how much time are you spending arguing with someone with dementia or going back over and over and over and reattempting things? If you just spend a half that amount of time on the front end, building a relationship with them, learning about them, and then kind of, working these creative tips into what you're doing, that actually is going to save you time on the back end, because you're not fighting, you're not arguing, you're not increasing their fight or flight response. So I encourage you to try to get to know your residents as much as possible, and then have an open mind that these things actually might save you time and might make your job easier. At the end of the day, our goals should always be to improve the lives of people with dementia. But in the day-to-day grind, I know sometimes that can feel a little bit of a distant goal. But that's what we're all here for. That's what we're all here for.
Yeah. Thank you for that encouragement. And it is completely accurate. How much time do we spend trying to do the thing that we want to do. And if we take that opportunity to actually use it wisely, learn, we will be so much more successful in what we're trying to accomplish. And
Absolutely.
at the end of the day, it's improving the lives of people living with dementia. So
Yeah.
thank you for your wisdom.
You're
I always
welcome.
love visiting with you. I always learn so much.
You're
and
welcome. Yeah.
I know everyone will be so encouraged.
Yeah, and if anyone wants to learn more about these kind of techniques or different, other examples, I have hundreds of them on my social media. So you can follow me at BeLightCare, BeLightCare, on Instagram, Facebook, TikTok.
All the places.
Yes.
Yes. And you're on LinkedIn.
And LinkedIn, Adria
as a
Thompson.
professional. And if you want to learn more about the podcast, it is Navigating the World with Your Aging Loved One on all of the podcast platforms, Apple, Spotify, and we'll gather on Instagram. Thanks, everybody.
Thanks.
Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.